great candidate for hip arthroscopy would be someone who is physically active, someone who's athletic, someone who enjoys doing physical activity. Generally, patients will complain of groin pain. That's generally where the hip is. Your ball and socket is actually located in the groin area. A lot of people tend to think that the hip is in the back, and they come in with their hand over here over the buttock area. That's actually your lower back. But when patients complain of hip and groin pain, they'll also complain of popping and clicking in the groin area. They'll also be complaining of pain when they're seated for a long period of time. If they're seated or they're going up and down stairs, kneeling, squatting, anytime they're flexing their hip up in that position and they complain of groin pain, that's always suspicious for somebody who may have a torn piece of cartilage or torn labrum in the hip and potentially could benefit from hip arthroscopy. As well as just history on physical exam, when we take these patients and we move the leg around, if we can reproduce their hip and groin pain with these movements, then that also would be suspicious for a torn labrum and possibly someone who could be helped with hip arthroscopy. And then in terms of x-rays and MRIs, we'll generally have x-rays which demonstrate what we call impingement, which is where you have that extra bump on the femoral head, which will then hit up against the cartilage, causing the labrum to tear. That can be seen on an x-ray. At the same time, on an x-ray, we can tell how much arthritis a patient has, because unfortunately, this is not a cure for arthritis. Patients with bad arthritis, unfortunately, will have to get a hip replacement. But if you have at least 2 millimeters of joint space on an x-ray, you could be a candidate for hip arthroscopy. And then the final test, the best test of them all, would be an MRI, or magnetic resonance imaging. With an MRI, you can actually see the torn labrum, the torn cartilage, and you can even see the impingement in a lot more detail. So someone who's physically active, has hip and groin pain, x-rays and an MRI would show a labral tear, and with impingement, I think would be the ideal candidate for a hip arthroscopy.